In the meantime, new Health Cabinet Secretary Dr. Debra Mlongo Barasa has pledged to ensure that the government's universal health coverage rollout will go on as planned on the 1st of October this year. Dr. Barasa says she will build on the progress made by her predecessor, that is Nakhumicha Wafula, under whose watch the work of transiting to the social health program started. Speaking while handing over to Barasa, Nakhumicha described her tenure as successful, citing the 56-day doctor strike as her lowest moment at the Afya House. Brenda Wanga reports.
You can exchange 100 indeed.
Nearly a month after the changes at the Ministry of Health were effected with the swearing in of the new CS for Health, the outgoing one, Susan Nakhumicha, returned to the ministry for one final task.
All the best.
To formally hand over the reins to her successor, Dr. Debra Barasa. Nakhumicha, who served for 22 months, is one of the cabinet secretaries that fell by the wayside in the president's cabinet reconstruction, but she says her time at the ministry, albeit brief, was consequential.
I live with my head held very high because of whatever we were able to achieve.
Nakhumicha presided over the ministry during the inception of the universal health coverage programs that have resulted in the Social Health Authority that promises to revolutionize healthcare in Kenya. She says this is her greatest achievement and her successor vows to see its successful rollout.
We did all the groundwork, so now it's up to you to fly the plane and ensure that Kenyans get universal health coverage.
So that would really be a win for the Ministry of Health if we are able to have all Kenyans able to access affordable quality care. So we'll run with that.
Dr. Barasa's job in overseeing the implementation of the Social Health Authority, however, may not be as simple. The plan is just about a month away from its launch, but it has already been beset with hurdles, with some of the laws set to operationalize the authority declared unconstitutional by the High Court. The new CS, however, is confident that these challenges will be overcome in time for the September 1st rollout.
All systems go on the 1st of October 2024. As we prepare for the transition, I urge Wananchis to register themselves and their dependents into the SHA to avoid last-minute rush.
Nakhumicha's time at the ministry was also marked with episodes of difficulties, including the mosquito net procurement scandal at KEMSA and the 59 days doctors' strike.
It was quite a low moment for us as a ministry, having to see that there are patients who need to be served and the doctors are not there to serve them. I must say that is one of the things that really was a low moment for me as I worked here.
As the change of guard happens here at the Ministry of Health, many will be keenly watching to see how the new occupant of the office of the CS will maneuver and navigate to help the country achieve the universal health coverage. Brenda Wanga, Citizen TV, Nairobi.